MLT Case Study Series 15. Deciphering Down Syndrome, a Chromosomal Analysis Case Study. From laboratory diagnosis to early intervention, unveiling the role of medical lab technologists. Down syndrome, an overview. Definition: Down syndrome is a genetic disorder caused by the presence of all or part of a third copy of chromosome 21. It is characterized by physical growth delays, characteristic facial features, and mild to moderate intellectual disability. Etiology: the most common form of Down syndrome, known as trisomy 21, occurs due to non-disjunction, a mistaken cell division that results in an embryo with 3 copies of chromosome 21 instead of 2. There are 2 other types, translocation Down syndrome and mosaic Down syndrome. Incidence: Down syndrome is the most common chromosome abnormality in humans, affecting approximately 1 in every 700 babies born in the United States. Risk factors: advanced maternal age is a significant risk factor, as the chances of having a child with Down syndrome increase with the age of the mother. Clinical features: physical characteristics, distinct facial features, flat facial profile, slanted eyes, small head, hypotonia, poor muscle tone, short stature, and a single deep crease across the palm of the hand. Health complications: congenital heart defects, respiratory and hearing problems, Alzheimer's disease, leukemia, and thyroid conditions. Diagnostic techniques: prenatal screening tests, blood tests, and ultrasound during the first and second trimesters to assess the risk. Diagnostic tests: amniocentesis, chorionic villus sampling, CVS, and percutaneous umbilical blood sampling, PUBS, for chromosomal analysis. Postnatal diagnosis, physical examination and chromosomal analysis through karyotyping. Laboratory role and case study. Case study: Baby John Doe. Patient information: newborn male, 6 hours old, born to a 38-year-old mother. Presentation: hypotonia, flat facial profile, excess skin at the nape of the neck. Initial tests: physical examination suggests Down syndrome. Pediatrician recommends karyotyping. Laboratory test: blood sample is collected for chromosomal analysis. Karyotyping is performed. Results: the karyotype report shows 47 chromosomes with an extra chromosome 21, confirming the diagnosis of trisomy 21 Down syndrome. Follow-up: the parents are counseled regarding the diagnosis, associated health risks, and interventions. Early intervention programs are recommended to support the child's development. Discussion: in diagnosing Down syndrome, medical lab technologists play a crucial role. The karyotype analysis in this case clearly showed an extra chromosome 21, indicative of trisomy 21, the most common form of Down syndrome. This diagnosis is vital for early intervention and management of the condition. It's important for technologists to understand the significance of accurate chromosome analysis and the impact it has on patient care and counseling. Conclusion: this case study highlights the importance of comprehensive prenatal screening and diagnostic testing in identifying Down syndrome. Medical lab technologists are at the forefront of performing these critical analyses, enabling early diagnosis and intervention, significantly improving the quality of life for affected individuals. Continuous education on advancements in genetic testing and a deep understanding of genetic disorders are essential for those in the field. Thank you. Vamsi. Please subscribe for more videos.